Okay, good morning, students. So in last class, I have mentioned that I will be starting the revisions chapter, the news chapter. What was the name of that chapter? What was the name of the chapter? If you can't see, we'll end the class.
Chronic renal failure.
Okay, chronic renal failure. I already give the notes. Like, is it so difficult to say or what? Like, so many participants of you are there? Like, okay, so let's start on chronic renal failure. So, what is the meaning of chronic renal failure, which I already explained? Chronic renal failure. According to you, no need the exact definition. We will be discussing. I'm going to show the screen also. So, what is chronic renal failure? What is chronic renal failure? What is chronic renal failure?
Chronic kidney disease.
Yes, it's chronic kidney disease. So what does it mean from chronic? What does it mean? Does it like slightly affecting the kidney or it is severely affecting the kidney?
Severely, ma'am.
Okay, good. Okay, then let us start. What happened? Like maximum student, they did not join. So many students did not join. What happened to them? Okay, I'll be sharing the screen. Is it visible?
Yes, ma'am.
Yes, ma'am. Okay, let's start. So whoever like haven't written yet, na, like some of you might forget your this copy and all, na, because of this sudden pandemic situation. So in your hostel, so you can just write it down. So this is chronic renal failure. Okay, first of all, let us discuss the definition, which I have already given to you all. So CKD, so chronic kidney disease, that is chronic renal failure, okay? That is chronic kidney disease. And it was also known as what? I have given one term, na? It was also known as what? Whoever know, always try to be the first one to respond. I said
End-stage
end stage renal disease. Okay, in short, it is known as what? In short, how do you write in short?
ESRD.
Very good. Yes, ESRD. Okay. Definition of CKD or else definition of ESRD or definition of CRF, that is chronic renal failure. I can give in that sense. So now let us discuss the definition. So chronic kidney disease, which is also known as the chronic renal disease. It is a rapidly progressive deteriorations or loss of renal function in which the body ability to maintain metabolic and fluid and electrolyte balance fails, resulting in uremia or azotemia over a period of months or years. So this definition is very important. You need to memorize, okay? You need to by heart this. So here in mainly it is mentioned that this chronic kidney disease, it is very, very much severe disease, okay? That is a progressive disease. So progressive means what? It developing gradually, okay? Progressive means it happening or else developing gradually. And then it develop gradually as well as it will deteriorate. Deteriorate means it will get worse. So the kidney disease, the damage will occur very progressively, means very gradually, as well as it will also get worse, deteriorate. And then lastly, what happened? The renal functions also will get damaged. There will be problem in the functioning, the renal functions, and then the ability to maintain the metabolic and fluid and electrolyte balance. All these also will be failed. because there will be damage in the kidney. It's not it. The kidney is severely damaged. So the body ability to maintain the metabolic as well as fluid as well as electrolyte, all this balance will be failed. And that failure will result in uremia or azotemia over a period of months or else years. So what is uremia? What is azotemia? All I give, all the meaning I give. Now you just need to tell me. I just want to check your knowledge. How attentive you are during my class. I want to know this. So tell me, what is uremia? What is azotemia? What is uremia? What is azotemia? Any one of you can say. Any one of you can say.
Uremia is high level of waste product in blood.
Uremia means, say loudly.
High level of waste product in blood.
High level of waste product in blood.
Yes, ma'am.
Okay, okay. And what is azotemia?
Ma'am, elevated level of nitrogen and urea.
Elevated level of nitrogen and urea. All of you, like, who were not attentive, who could not respond, write it down. Whatever, like Sujana said, write it down. Okay, that was all about the definition. So coming to the next, you all are clear, right? What is the CKD? Yes or no? Okay, okay, let's move on. So I could have just explained also, but like thinking about some of you, I have given the slide nicely. Later on, if you want the PDF of this, you can ask me. Let us discuss the etiology one by one. The first etiology that I gave was chronic glomerulonephritis. etiology में बार-बार explain किया था etiology का मतलब है क्या का वजह से chronic kidney failure होगा या फिर chronic renal failure होगा या फिर end stage renal disease होगा. For what reason? So that is what we will be discussing one by one. So what is chronic? Number one is because of chronic glomerulonephritis, a person can suffer from chronic renal disease. So what is glomerulonephritis? Which was very common. Nephritis, TIST, glomerulonephritis.
Inflammation of glomeruli.
Yes, very good. Chronic glomerulonephritis means there will be a glomerulonephritis is inflammation of the glomeruli, and here in the above it is written chronic. That means the glomeruli is severely affected. Understand? So you can simply write in the bracket, those who haven't written yet, inflammation of the glomeruli. So if there is inflammation in your glomeruli, that is your glomeruli is severely like inflamed, then what happened? That can lead to chronic kidney disease. Are you clear?
Yes, ma'am.
Okay, let's move on. Next is diabetes mellitus, which is very common, diabetes mellitus. So this diabetes mellitus is what? What is the meaning of this diabetes mellitus? I keep on repeating this, diabetes mellitus. Any one of you can say.
Level of sugar.
Level of sugar.
Okay, like a level of sugar. Okay, इंसान का sugar level बहुत ज़्यादा होगा. Okay, that can lead to diabetes mellitus. So do you know what is the, like you just said, na, that diabetes mellitus means like the normal means you said that the level of the sugar will be high in a person, isn't it? So in order to know that the level of sugar is high, so can you please tell me the normal value of your glucose? नॉर्मल वैल्यू नहीं तो कैसे पता चलेगा कि किसी इंसान का डायबिटीज है? You have to check the sugar is not it in that glucometer. So once you check it from that drip stick, you have to check from glucometer, then you can like diagnose that he or she is suffering from diabetes mellitus. So in order to say that, what will be the normal value? What is the normal value of this glucose? Any one of you? Any one of you? Anyone? Anyone? Any one of you?
No, ma'am.
because like see, have you ever see glucometer? अगर किसी का घर में या your parents or your like relative, your neighbor are diabetes, some of them like doctor used to suggest ना कि अपना घर में एक glucometer रखो ताकि like you can daily assess the fasting blood sugar, you know, the postprandial blood sugar, all these things, random blood sugar, all this you can check. So do you want to know the normal value? Yes or
Yes,
no?
ma'am.
Okay, like okay, actually now it vary. Okay, like sometimes like in different it used to be written, but what we have learned is the normal value of this the blood sugar level is 70 to 140. Okay, mg per dl. You can write it down. 70 to 140 mg per dl. 70 to 140. mg per dl. Okay. Okay, diabetes mellitus, every one of you are clear. And this, you know, like बहुत ज़्यादा reason है, like बहुत ज़्यादा causes है. Okay, I have given you like 11 causes, I think. Out of those 11 causes, okay, the most common are diabetes mellitus. अगर किसी का diabetes होने से ना उसका this chronic kidney disease होने का बहुत ज़्यादा chances है. You have seen chronic glomerular nephritis also, but these are not that much common. But the main common is diabetes mellitus, all this. And then the next is high blood pressure. This two, okay, this two is very common. किसी का diabetes हुआ उसके साथ साथ उसका high blood pressure भी होगा. तो like या फिर सिर्फ diabetes होने से भी like there is a chances of developing chronic kidney disease, and if there is like high BP also there is a chances of developing chronic kidney disease. So it's very important. If you forget so many etiology also, at least remember this 2 points. Are you clear about this?
Yes, ma'am.
Okay, next is long-term infections such as chronic pyelonephritis and tuberculosis. So long-term infection, okay, that is chronic. बहुत दिनों से infection हो रहा है, such as what type of infection? So chronic pyelonephritis as well as tuberculosis. So this, what is the meaning of pyelonephritis? Very, very common. I have explained in UTI also everywhere. What is pyelonephritis? Don't tell me that you don't know. It will be such
Inflammation
a
of the kidney.
inflammation of the
Kidney.
inflammation of the kidney. Okay, inflammation of the kidney. Okay, is it correct, Other? Yes or no?
Yes, ma'am.
Okay, then what is tuberculosis? TB, Sunana, TB. So what is tuberculosis? Tell me.
Tumor in the kidney.
Say all this I have explained. You just need, I want to check your knowledge, you know, because this is revision. ऐसा थोड़ी ना है कि मैंने पहली बार सिखाया है. So I just want to test your knowledge. So what is this chronic pyelonephritis? You already know. What is tuberculosis? Even during my explanation, I already told you that this is the tuberculosis is the, you know, like it is the infection. Okay, that is the infection. It is a infections which is caused by bacterial. Okay, then and I even told you all the name of that bacteria. What was the name of that bacteria that caused tuberculosis?
Mycobacterium TB.
Yes, very good. Mycobacterium tuberculosis. Okay. Okay, Mycobacterium tuberculosis. All of you who don't know, you just write it down. Mycobacterium tuberculosis. I don't think I need to give you the spelling. Long-term infection and do you need explanation? Mycobacterium tuberculosis?
No.
No, I think it's not required now. So in tuberculosis, isn't it tuberculosis? It is the infectious bacterial disease, okay? Tuberculosis, this is an infectious bacterial disease that affect our what? What organs it affect in tuberculosis? What organs it mainly affect? Ari, I already said no. It mainly affect our.
Lungs. Lungs.
Yes, very good, because tuberculosis TB, na, it is an infection bacterial disease that mainly affect our lungs. So in short, you write TB. So don't get confused. And this pyelonephritis also, this was also in the inflammation of the kidney, is not it? That also result mainly due to some bacterial infection. So all these long-term infection, no? This chronic pyelonephritis is also the infection that is caused by bacteria, and tuberculosis is also the infection that is caused by bacteria. And if the infections that cause is of long-term infection, then that can lead to chronic kidney disease. Are you clear?
Yes, sir.
Let's move on.
Yes, ma'am.
Polycystic kidney disease number 5, PKD. PKD, I think I don't need to explain this. Let's not waste time, because recently I have already discussed about this. Anyone want to answer this? What is PKD? Any one of you, or else no need? Polycystic kidney disease. The PKD, polycystic kidney disease. Okay,
It is genetic.
multiple cysts will be occur in your kidney. It's not it. Many picture bhi dikhaya tha. I have shown you all. I still remember normal kidney, and in the sidewise I have given the polycystic kidney disease, PKD. Understand? Where there were like above the kidney, there were lots of cyst formation. Understand? And that cyst will vary in size, and they can grow very large. Okay, all these cysts. And I already told you many times that cyst, this is the abnormal non-cancerous growth that is filled with liquid or else with some like semi-solid substances. All those things I already explained. And next is injury or trauma. What is trauma? Injury, every one of you knew. Because of the injury or trauma, you can have chronic kidney disease. So what is trauma? Student, what is trauma? What is trauma? Srijana, what is trauma?
Ma'am, stress or disturbing event.
Trauma. Oh, okay, okay. That is trauma. And then let's move to another point, that is kidney stones and infections. And kidney stone, I think you already discussed about this kidney stone, is not it? With from your new ma'am, that Shaban ma'am, isn't it? Kidney stone, yes or no?
No.
Okay, kidney stone, because of kidney stone, if there is stone in your kidney, okay, as well as if there is infection in your kidney, that can lead to chronic kidney disease. Okay, number 8, reflux nephropathy. I explained this very nicely during my offline class. Reflux means what? Any one of you?
Urine again go to the kidney.
What? Say loudly, say loudly. I think it is correct.
Urine again go to the kidney.
Yes, yes. Okay, you have little bit idea. Okay, okay. Reflux means what? Flow back or return? Where? Return? Who want to answer? Marcy, can you please tell me nicely what is reflux nephropathy?
When the urine flows back to the kidney, it's called reflux nephropathy.
Okay, okay. Reflux nephropathy. Okay, okay. It's good. All of you understand this. If like that situation happen, okay, that can lead to chronic kidney failure, because like instead of like excreting out now, it go back to the kidney, which is like abnormal functions. So because of that, it can lead to this end stage renal disease. Next, number 9, certain toxic chemicals. So there are also certain toxic chemicals, okay, and the name of those chemicals are cadmium, mercury, and there are lots and lots more. So like if you can just memorize these two, that's enough. That certain toxic chemicals like cadmium, mercury, all these toxic chemical, these are toxic chemical, and this can lead to chronic kidney disease. So next, interstitial nephritis. So this will be explained by Srijana. What is interstitial nephritis?
Ma'am, it is a disorder in which the space between the kidney tubules become swollen or inflamed.
The space between the
Kidney tubules become swollen or inflamed.
all of you are clear, or else you need one more explanation?
No, ma'am.
You all are clear?
Yes, ma'am.
Okay. Let's move on then. Okay, next last is developmental or congenital disorder. Okay, because of the this congenital disorder too, you already know. Now I have already discussed recently. That is any kind of disorders that any kind of anomalies that occurs from birth. Okay, that is known as the congenital, and that disorder, if it occur, that can lead to chronic kidney disease. And developmental disorder. What is developmental disorder? What is developmental disorder? Developmental disorder. Developmental disorder. Any one of you? I even explained this, but still. Developmental disorder. Ari, whatever I have explained in my offline class, all those, if you were attentive, should just share that. Developmental disorder means there will be impair in what? In your physical and mental activities. Is not it. There will be impair in your physical learning. There will be a language or behavior problem. You will have communication problem. All this, understand? Like to talk or to communicate with others, you will face problem. Even in the language also you will have problem, like slurring of voice, all those you will have. And then behavior, there will be behavior changes also, like even you will find a difficulty in learning. All these things, all those terms are indicated under this developmental disorder, understand? And all those kind of problem, you know, like all those kind of disorder that can lead to chronic kidney disease. So these are the 11 points that I have given. So let us see again one by one. So number one is chronic glomerulonephritis. Number two, DM, diabetes mellitus, high BP, long-term infection, that is chronic pyelonephritis, tuberculosis. Number five, PKD. Number six, injury or trauma. Number seven, kidney stone and infection. Number eight, reflux, nephropathy. Number nine, these toxic chemicals. Number 10, interstitial nephritis. Number 11, developmental or congenital disorder. So these are the 11 etiology that can lead to chronic kidney disease. Are you clear, student, all of you?
Yes, ma'am.
Okay,
Yes,
shall we move on to the clinical manifestation?
Yes, ma'am.
Okay, let's move on. Clinical manifestation number one is GI. What is GI? Again, silent. What is GI?
Gastrointestinal.
Yes, gastrointestinal.
Gastrointestinal.
So gastrointestinal. Okay, good. So under the gastrointestinal, like means the clinical manifestation, you can also write like, you know, in like without the system wise, okay, system wise in a sense, okay, like all the system like GI, like respiratory, all those cardiovascular, all these musculoskeleton, all these things, like without that, apart from that, you can simply write also. But it is better if you know that when you in GI, what are the clinical manifestation you can get under the GI, like system wise, if you know, that is much beneficial. So let us discuss one by one. Clinical manifestation number one is GI, so that is gastrointestinal. Under this we have find nausea, vomiting, anorexia, hiccups, ulceration of GI tract, and hemorrhage. Okay, these were the point that I have given to you. Number first, I gave nausea and vomiting. So nausea and vomiting to sabko pata hai, no need to explain. Anorexia, what was anorexia? What
Loss
was
of appetite.
Yes, very good. Loss of appetite. So loss of appetite, like you don't feel like eating, like understand? If you feel like, if you ate little bit also, you feel full. There is a full feeling of fullness. All those things are anorexia. So, and then hiccups. What is hiccups? I think hiccups, The hiccups demo was given by Samuel, I think, during the offline class, I guess, if I'm not wrong. Hiccups. All of you know what is hiccups? All of you
Yes,
know what
ma'am.
is hiccups?
Yes, ma'am.
Okay, okay. Okay, then let me, during your childhood times, even your parents, okay, when you have hiccups, what they used to tell you to do? वो hiccups को हटाने के लिए क्या करने को बोलते हैं?
Drink
Drink
water.
water.
Yes. Even they used to tell na, like you drink water, like you take a sip of water 10 times without taking breath. Something they used to say like that, isn't it? When we were small, isn't it? Yes or no?
Yes, ma'am.
Okay, okay. That means you understand. Okay. And then next is ulceration of GI tract and hemorrhage. So hemorrhage means, every one of you know, hemorrhage means bleeding. And then there will be like ulceration of GI tract. So your gastrointestinal tract, there will be ulceration. So what is ulceration? What is ulceration? Ulcer, Sunana, ulceration. Ulcer, ulcer.
Yes, ma'am.
So tell me the meaning. What is ulceration? Anyone want to share their idea? What is ulceration? Srijana, what is ulceration?
Ma'am, it doesn't heal so easily.
Yeah, it's kind of inflammation, isn't it? That doesn't heal easily. It's kind of the formation of the break on the skin or else on the surface of the organ. It's like kind of inflammation, okay? That doesn't heal easily. All of you, are you clear?
Yes, ma'am.
Yes, it's kind of. Okay, Srijana, please take
Yes.
attendance. Okay. So shall we move on to the next system? Yes or no?
Yes, ma'am.
Okay. Okay, next is cardiovascular. So as soon as you heard this cardio, okay, what comes in your mind? Say fast, time is very less. As soon as you heard cardio, what comes in your mind? Say.
Heart.
Oh, heart is not it, heart. As soon as you heard the term cardio, it comes heart. So under this, what kind of sign and symptoms you will get? Cardiovascular के अंदर में क्या क्या clinical features या sign और symptoms दिखाई देगा? सबसे पहले hypertension, next is pericarditis, and the next is pericardial effusion. So if you have any if you have written any spelling mistake and all, you can just write it down. एक तो hypertension होगा, BP बहुत high होगा, और next is pericarditis and pericardial effusion. I think all this meaning I already gave you all. What is pericarditis and all? What is pericarditis? Again, let me ask. Pericarditis? Yesterday also, not yesterday, that day also I asked.
Of the heart, ma'am.
Say loudly.
Covering layer of the heart, ma'am.
Covering of the heart, that one was pericardium. It's not it. Now I'm asking what is pericarditis?
Excessive fluid between the heart and the sac surrounding the heart, known as pericardium.
Is it? That is pericarditis.
No, ma'am.
That is what?
Pericarditis, covering layer of the heart.
That is pericardium. And then what is pericarditis? Any one of you?
Pericarditis is inflammation of pericardium.
Yes, it's very correct. Okay, because you know now that what is pericardium, you already know now. Pericardium means it is a sac-like membrane that surround the heart. Is not it? If there is swelling or inflammation in the membrane that surround the heart, okay, then that is known as pericarditis. And you can simply write it that inflammation of the pericardium is known as pericarditis. Is it clear? Is it clear? Okay. Okay, next is pericardial effusion. What was pericardial effusion? Just before you have mentioned it. It is the build up of extra fluid in the space around the heart. It's not it. What was that? What I had given you all? If there is excess fluid between the heart and the sac that surround the heart, it's not it.
Yes, ma'am.
Got it. Okay, pericardial effusion, don't get confused. Okay, what is pericarditis? Don't get confused. What is pericardial effusion? Don't get confused between these two. Pericarditis is the inflammation of the of the sac, like that is the membrane covering the heart. And pericardial effusion means there will be excess fluid between the heart, between our heart and the sac, that is pericardium. If there is excess fluid between the heart and the pericardium, then that is known as pericardial effusion. Are you clear?
Yes, ma'am.
Okay, let's move on. Next is respiratory. So in respiratory, first of all, I have given you all pulmonary edema, and the other one is pleural effusion. So in the respiratory also, again, you will get these signs and symptoms. You will find pulmonary edema, as well as you will also find pleural effusion. So talking about the pleural effusion, I think pleural effusion, I think I already give you the meaning and all. Don't get confused, okay? What I gave you before, that was pericardial effusion, and now what you are studying in respiratory is pleural effusion, pleural, and the other one is pulmonary edema. So what was pulmonary edema? Pulmonary edema.
Excessive.
Say pulmonary edema. Okay, if you all can't say. Say.
Accumulation of fluid in the lung.
Accumulation of blood in the lung.
No, fluid in the lung.
Yes, there will be, it is a condition, okay, where there excess fluid are present in our lung. So pulmonary सुन के ही दिमाग में आ जाना चाहिए कि lung. It relates to lung. So when there is excess fluid present in the lung, that is known as pulmonary edema. Are you clear?
Yes,
All of
ma'am.
you? Okay. What is pleural effusion then? What is pleural effusion?
Fluid.
Say, all of you. I think it's correct. Okay. Full fluid build up. Say.
Between the tissue that line the lungs and the chest.
Very good. Okay. Means like there will be like build up of fluid. Okay. Build up of fluid between the tissue that line the lung. Okay. There is a tissue that line the lung, okay? In that, the tissue that line the lung and the chest. And in between that lining, there will be accumulation of fluid. That means fluid will be built up. That is known as pleural effusion. So don't get confused between these two as well. So are you clear about the respiratory clinical manifestation? Yes or no? Okay, let's move on. Next is metabolic and endocrine. So in metabolic and endocrine, like all of you who have any spelling mistake, write it down first, okay? Because time is very less, only 3 minutes left. So in metabolic and endocrine, what are the clinical manifestation? What are the signs and symptoms that you will see is there will be a glucose intolerance. So glucose intolerance is glucose intolerance. Like you have seen, there will be like diabetes mellitus, isn't it? So because of the like glucose intolerance, like the glucose level is very high or very low, like there will be intolerance. That is known as glucose intolerance. And next, hyperlipidemia. And next is sex hormone disturbances causing decreased libido, amenorrhea. That means even in our sex hormone, in sex hormone, there will be a disturbances in our sex hormones, and because of that disturbance in our sex hormone, that will decrease the libido as well as amenorrhea. So what is libido? What is libido? लिबिडो भूल गया क्या? मैंने इतना अच्छा से एक्सप्लेन किया. लिबिडो. Libido. Srijana, what is libido?
Ma'am, sexual desire.
Yes. Obviously, if they are, because we have sex hormone, it's not it. So if we have sex hormones, so if there is disturbances in our sex hormones, then obviously our desire to do sexual intercourse, that also will decrease. Understand? As well as that can lead to amenorrhea. It can also, you can also see a sign of amenorrhea because of these disturbances in the sexual hormone. It's our sex hormones. So what are our sex hormones? Don't tell me you don't know. Anyone? Whoever knows, say fast. 1 minute left. Say fast. Sex hormone, say fast. Okay, this will be the homework. So I will ask you all tomorrow, okay? Okay, are you clear? This much for today. I want to teach you one more, but it's only 1 minute left. So this much I'll be teaching you all. Are you clear today, class?
Yes, ma'am.
Yes, ma'am.
Ma'am, can I ask you one question?
Yes, say. Say fast, okay? There is only
Ma'am,
1 minute. Say fast.
ma'am, is it infection and inflammation same?
Infection and
Inflammation.
inflammation, there is a slight similarity, okay? There is a slight similarity, but it is not exactly same.
Okay, ma'am.
Anyone, any question?
No, ma'am.
Anyone? Okay, then it's only 1 minute left. Okay, thank you everyone.